Welcome to Decider's video on what is health research. After this presentation, you will better understand what health is, what research is, and some examples, why research is important, where research funding comes from, and how to have a voice in this process. If you have any questions at the end, please ask your facilitators. So let's start with the story. There once was a community that wanted to improve the overall health of the people who live there. They started by asking the question, what is health? The World Health Organization says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The World Health Organization's definition can be illustrated as a health triangle. The health triangle has physical, social, and mental health sides. The community noticed a cloud of purple smog and wondered if it was making people unhealthy. So they said,
"We need answers. We need research."
The community members all had different ideas of what research really is and what it could do to help answer their questions. So when we asked people, what is research, they said,
monkeys, mice, rats, guinea pigs.
And they also said,
the Tuskegee syphilis study and testing drugs on people.
People also said that when they thought of research, they thought of data, lots of information, and numbers. Community members were wondering,
what is research?
Research bridges the gap between questions and answers. The community wondered if research could bring them answers to their purple smog questions. They asked, what has health research done? Health research has used experiments and other scientific ways to help learn about what affects human health. Initially, smoking was considered good for you. Through health research, they found that smoking was linked with an increase in lung cancer. Experiments are also used to discover better ways to prevent or treat diseases. The disease polio paralyzed thousands of children every year. Through health research, an effective vaccine was developed to prevent polio. Today, polio has been eliminated from most of the world. Health research also discovers ways to improve health in many different settings. Rural communities have few choices for care. Research can find ways to improve care in rural areas using telemedicine, which uses technology to diagnose and treat patients from far away. Since the community was concerned about asthma, they wondered if research could help.
Yes! Research uses what we know to find out what we don't know.
Health research has found some answers to asthma. For instance, doctors and scientists used to think asthma was psychological and that children who wheezed were just crying out for their mother. But when research was done, scientists looked at the airways and found inflammation which blocked the airways, making it difficult to breathe. Now, asthma is treated with anti-inflammatory medicines like inhaled steroids. Through health research, we now know how to diagnose and treat asthma, including in young children, as well as what triggers asthma, such as pollen, dust, or even pollution and chemical fumes. The community was ready for research. They asked,
is there a link between asthma and this purple smog? How can we get funding to answer this question?
Then they tried to find funding for research. Even though they thought purple smog was a big concern in their community, they were told that purple smog was not a priority of any foundation or government agency, and it was not going to be funded. In the back of a room, a little girl raised her hand and asked, where do research priorities come from? There are a few places where a lot of health research is funded. To mention a few, pharmaceutical companies, the government, rich donors, or charities. In 2011, industry spent $80 billion on research. The government spent $40 billion on research. And others spent $20 billion on research. Community members asked, where does all this money come from? Your tax dollars pay for government research. They also asked, But who decides which questions are most important? We want it to be you! In our story, the community wanted a voice in the health research funding process. And they were heard. The community partnered with academics and others to answer their questions about linking purple smog with their health. This community story has a happy ending. Now it's your turn. We know what the research questions that the community members had when dealing with the purple smog. Now we want to know what your research questions are. You have the ear of decision makers. They are listening to what health issues and priorities are important to you and your community. As a way to help get community voices heard by decision makers, we're going to play a game called Chat. This stands for Choosing All Together. We will use Chat to set research priorities for yourself and for your community. In this video, we covered what health is, what research is, and discussed some examples, why research is important, where research funding comes from, and how to have a voice in the process. Thank you, and have fun playing Chat.